Welcome to the MacLean Center's interdisciplinary lecture series. Before I introduce today's speakers, I want to remind everyone next week is the last week of the series. It's Dr. Carl Elliott will be joining us from the University of Minnesota. So we hope everyone will come back for next week. Today, we are delighted to welcome Professor Charlene Galarneau. Did I say it right?
You did.
Okay, perfect.
Good French Canadian.
Okay. Charlene is a senior lecturer at the Department of Global Health and Social Medicine and the Center for Bioethics at Harvard Medical School. She is also Associate Professor Emerita in Wellesley's College Women's and Gender Studies Department. Her research explores the ethics of healthcare, public health, and U.S. health policy. In particular, conceptions and practices of social justice that take seriously multiple and diverse communities and their interesting social relations, including gender, race, and geography. Her 2016 book, Communities of Healthcare Justice, cultivates a concept of community justice that understands communities as critical participants in determining the nature of just healthcare. Her articles appear in a wide range of bioethics-related journals, including the American Journal of Bioethics, the Journal of Law, Medicine, and Ethics, the Journal of Bioethical Inquiry, Health and Human Rights, the Hastings Center Report, Public Health Ethics, the Journal of Healthcare of the Poor and Underserved, the Canadian Journal of Bioethics, and Narrative Inquiry in Bioethics. She holds a doctorate from Harvard University in Religious, Social Ethics, and Health Policy, and a master's degree from the Iliff School of Theology. Finally, and importantly, her interest in an ongoing study of healthcare ethics and social justice was initially motivated by her early work in rural community and migrant health centers and with the communities they serve. Professor Galarneau, we're very pleased to have you here. It's an honor, and we really look forward to your talk. So thank you so much.
Thank you for that. That was lovely. Can you all hear me? Yeah. Great. Thanks. And also thank you for the opportunity to come and to think a little bit about advocacy in relation to the work that I'm doing, which is, as you've heard, about eugenics, and particularly Vermont. So you'll hear Vermont popping up a little bit here. So as you may have noticed, the language of eugenics is having a bit of a revival today, whether in political rhetoric or in discussions about genetic technologies, whether things are particular procedures, if you will, are eugenic or not, whether we might call these things hard eugenics or soft eugenics or liberal eugenics or contemporary eugenics or new eugenics. There's a lot of different language out there. But my focus today is going to be on what I think we in healthcare have to learn about our past as we simultaneously attend to the present and to the future. That past, which I'm going to focus in early 20th and late 19th century eugenics in the US, including healthcare's roles in it, and that's really important here, are part of our present, both historically and ethically. And I'm not a historian by training, but my ethics training and my commitments to just health, to health equity, and to communities as critical moral actors in both of those means I've had to unlearn some history, learn some new history in order to do good ethics. So up front, here's the takeaway for today. The dominant narrative in the US about eugenics neglects morally relevant social context and relations, says little about healthcare's roles in eugenics. Fuller narratives are needed to reveal the oppressive social context into which disproportionate harms were experienced by some communities. Physicians and other care professionals advocated and participated in eugenics in many ways. A few states have sanctioned eugenics and have attempted moral repair through apology, memorialization, renaming, reparations, truth and reconciliation commissions, experiences that I think healthcare might learn from. An emerging discussion of transitional justice in healthcare advocates for these same strategies, potentially ending the moral silence around past eugenics in healthcare. So here's just a little bit of where we're headed. I want to say a little bit about why I think we need to rethink all this. What is eugenics? Talk about the dominant narrative, a little more inclusive narrative, say in more detail what medicine and healthcare's involvements have been, talk about some moral responses, and then talk about transitional justice here. So why rethink? The question actually implies that we have been thinking about US eugenics. right? And what that might mean ethically. Importantly, medical training in the US often includes some attention to the eugenics of the Nazi Holocaust, often in relation to medical professionalism, right, and the moral development of medical students. And in bioethics education, we attend to the Nuremberg Code, right, in part, its part in the origins and development of research ethics. But except for the work of very few individuals, this field we might call health ethics more broadly, right, has been relatively silent about eugenics in the US. We rarely recognize, not to mention ethically assess, the myriad ways that health professionals, particularly physicians and nurses and social workers, have advocated and strongly for eugenics, for procreation in the name of human betterment, race betterment, or the good of society. Right? And this neglect has costs that I think are eloquently summarized in Jacqueline Baba's book, Time for Reparations. The moral trade-offs linked to the culture of silence have an afterlife. They transmit an inaccurate historical record, deny survivors and their heirs their due, and vitiate present and future efforts to prevent injustice. Moreover, the traces carved by unrepaired past injustices endure in the political, social, and economic arrangements bequeathed to the present and future, the systems for transmission of property, wealth, status, authority, and power. Traces of unrepaired past injustices carved by US eugenics also endure in our health systems, in our health professions, and in our bodies. Right, as premature mortality, preventable disease and injury, and inadequate access to care, particularly in marginalized communities, and affecting all of us. If we do not remember past harms and advocate for moral repair, these traces persist in the present and make a more just future difficult, if not impossible. So we have to rethink some of this. And let me just say a little bit about how I'm using the word eugenics. It's a big term, multifaceted idea, right? That means and has meant many things. A scientific movement, a popular movement, efficient social engineering, and oppressive social control. A century ago, eugenics, the term, was for many academic, social, political, medical elites, an optimistic word. One that, through the science of heredity, promised a better world, populated with more superior persons, notably like themselves, we'd have to say, and fewer inferior persons, people deemed burdens on society and at risk of bearing future offspring that would be the same. In the early 20th century, some understood that a person's traits, both positive and problematic, were passed down to the next generation through one's germ plasm. And others thought that at least some of that transmission happened through one's familial and social environment. And many thought it was some mix of both. Some focused on controlling procreation in the name of race betterment, in the name of higher IQs, more healthy military draftees, more healthy children, and for some, in the name of reducing public spending on care for disabled children and needy families. Threatened by mixed race persons and those identified as non-white, some white persons aspired to create a more Nordic stock. Or in Vermont, we might call this, or it was called, Old American or Yankee stock. Importantly, eugenics was shaped by and shaped the social dynamics of particular places. That is to say, eugenics and the different social prejudices of different spaces became inextricably intertwined. So eugenics developed somewhat differently in California than it did in North Carolina, than it did in Illinois, and than it did in Vermont. So in this sense, there are only particular eugenics, not some universal experience. That said, there is a dominant narrative about US eugenics, one that I think we have to get beyond if we're going to do good ethics around it. This prevailing narrative obscures much of what we need to do much of what we need to know to do significant analysis and to begin to frame what justice might mean. So, a little bit about the dominant narrative. I call this the pseudoscience ambitious men, it's over now story. And it goes something like this. Once upon a time, in 1883 to be precise, polymath statistician Francis Galton at the University College of London coined the term eugenics. Often translated as well-born, eugenics referred to the science of shaping society by controlling the procreation of its members through selective breeding. Nearly 20 years later, Charles Davenport, who had been a Harvard University professor and then was a University of Chicago zoology professor, met Galton in the UK, returned to the US, energetically committed to the promotion of eugenics in the name of improving what he saw as a society in social decline. Eugenics, he argued, could remedy the social ills of poverty, crime, illness, and immigration by promoting, right, the procreation of persons deemed superior and restricting the procreation and the immigration of those deemed inferior. Now, Davenport gathered academics and researchers, and he convinced philanthropist Mary Harriman, who was a wealthy railroad family member, that her funds would be better spent preventing the births of what were called defective, delinquent, or dependent children or persons than on spending her money on social welfare programs that were designed to care for them. With Harriman's funding, the Eugenics Record Office opened in Cold Spring Harbor in New York in 1910. Directed by Harry Laughlin, the ERO became Eugenics Central, if you will, in the US. Built a network and then a movement of like-minded people, sponsoring conferences, journals, all seeking to prove the heritability of fitness. The ERO offered summer training programs, mostly to social workers, who then spread out across the US, collecting family genealogical data that was then stored in the records office. In 1921, the American Museum of Natural History in New York hosted the second International Conference on Eugenics, attracting more than 300 scientists, researchers, and eugenics promoters, probably the largest gathering of self-identified eugenicists ever. The movement drew money and attention, furthering its goals of restricting the procreation of inferior persons. And to these ends, they advocated legalized involuntary sterilization, segregation or institutionalization of persons, and immigration and marriage restrictions. The ERO created a model state law about sterilization, variants of which many states passed. And in 1927, the US Supreme Court case Buck v. Bell affirmed the constitutionality of the state of Virginia's model law. And you've probably read this or heard of this. Justice Oliver Wendell Holmes Jr. wrote the majority opinion, and his infamous words at the end here, 3 generations of imbeciles are enough. This is actually worth reading. It's only about an 8-paragraph opinion if you ever wanted to read it, but you might be interested in the line before that too, those of you who are interested in policy and law. The principle that sustains compulsory vaccination is broad enough to cover the cutting of fallopian tubes. All right, surgeons. Again, citing the Jacobson v. Massachusetts case, right, around compulsory sterilization. Here are 2 of the 3 generations that Holmes was talking about, Carrie Buck and her mother, Emma. By 1930, 32 states had approved some sort of eugenic sterilization legislation, and the number of sterilizations rose steeply. The rise of Nazism in the 30s and 40s and its eugenic horrors, combined with challenges in the US to the science of eugenics, led to the closure of ERO in 1939 and the rapid demise of US eugenics, or at least so many thought, by about 1950. End of story. And many thought that was the end also, right, of eugenics. Now, nothing of the details that I've spoken about are really untrue in this dominant narrative, but it's quite partial. And alone, it's very misleading as a representation of US eugenics. It neglects those social contexts and the relational contexts of that era. And it tells us almost nothing about how medicine and healthcare was involved. Simply put, history matters morally. So we need more and fuller narratives to do strong ethics. So let me just say a little bit about a more inclusive history. And I'm just briefly saying something that's larger, but it's obviously still incomplete. But to talk about the eugenics era, which we usually think of as 1950 to 1900 to about 1950. Very often we want to start thinking before that, right into the 1800s. We actually want to think earlier, but for now, let's just say that. A time of a lot of political and social change here in the US. Slavery, Reconstruction, and Jim Crow reflected and reinforced the rampant anti-Black racism of the time. Slavery, as historian Raina Hogarth puts it, laid the groundwork for eugenics. We saw in this era the active removal of indigenous tribes from land in the earlier 1800s, which set the stage for westward expansion. And with the establishment of boarding schools, continued the genocide of indigenous peoples. Strong anti-immigrant sentiment, especially targeting immigrants from Southern and Eastern Europe and Asia, manifested early on as immigration restriction laws, particularly targeting Chinese immigrants. The technological innovation of industrialization, and with it, urbanization, fed concerns about rural and agricultural decline. In the late 1900s, late 19th century, we see the beginnings of the progressive era, a movement of social reform for civic improvement, partly driven by white middle class and elite women who advocated, for example, for labor laws, and who formed private charities to provide services for some people in need. It was a time of great inequities in health and healthcare by race, gender, class, and nationality. Local poor farms housed some of the needy, and many states were beginning to build public hospitals for persons with mental illness and disability. Now note, everything I've said in this fuller narrative so far, these social and political dynamics were present before 1900, so before the eugenics era. And it's important for us to realize that it's into this era and into this environment, right, that Galton's eugenics entered. And in that way, eugenics came to both reflect and reinforce the social hierarchies of the time. So moving to that 1900 to 1950, many of these already mentioned social dynamics intensified. More urbanization, more economic stressors, greater poverty, growing white fear of race suicide and the loss of political power in light of immigration, government role in social welfare, more public institutions, and more private social reform efforts. Add to that landscape the 1918-1919 influenza epidemic, then World War I. The draft for World War I actually saw that many draftees were deemed unfit for military service. And that was used also as a justification for strengthening fitness and for the emerging eugenics movement. The 1924 Immigration Restriction Act broadened earlier immigration laws to limit the number of immigrants allowed into the US from all countries. And increasingly, local communities argued that the care for dependent persons on poor farms was becoming too expensive. Some embraced the idea that it would be less costly to sterilize than to institutionalize. So this fuller narrative tells us some things we didn't hear in that more narrow narrative. It tells us that more than 60,000 persons were sterilized in these years, roughly 2/3 of them women, and disproportionate numbers of poor white, Black, Indigenous, and people of color. This narrative tells us that who was sterilized depended on the intersecting social hierarchies of the time and place. For example, in some southern states where sterilization was performed only on institutionalized persons, and where these institutions admitted only white persons, it was disproportionately poor white people who were sterilized. But as racial dynamics shifted, so too did those who were sterilized. In North Carolina in the 1920s and 30s, about 23% of the persons sterilized were African American. Over time, and with the growth of the welfare state, the civil rights movement, and the perception that Black women and children were dependent on public benefits and thus were public burdens, the racial ratio of sterilization shifted. By 1966, 64% of the sterilizations in North Carolina were performed on African Americans. A more inclusive narrative also tells us that the eugenics movement supported and was supported by the simultaneously emerging child welfare movement, pediatrics also at this time, right? Women's clubs joined with social workers and physicians to promote infant and child health and to care for orphans and struggling families post-war and post-influenza. Vermont's statewide organization of social workers spun off a committee to form the Vermont Children's Aid Society, which became central in the state's eugenics movement. This dominant, non-dominant, and more inclusive history teaches us several ethically important things. Again, eugenics happened as it did, not simply because it was perceived to be an elegant scientific theory combined with the promise of social improvement, but because it was aligned with and furthered existing oppressive social systems. Present in virtually all eugenic aims and expressions were multiple social hierarchies. A racial hierarchy that placed whites on top, Black and Indigenous people often at bottom, and immigrants somewhere in between. Right? Eugenics assumed also an ability hierarchy that placed ostensibly high IQ and able-bodied persons, or those matching some sort of standard body, on top, and those with lower IQ and physical and mental disabilities below. As geneticist Adam Rutherford has written, and this is a new book of his, what remains is the cold fact that Black people were disproportionately sterilized under state eugenic policies because eugenics in a racist society ultimately has hierarchy, racism, and classism threaded into its DNA. From such histories, this more inclusive history and narrative, we also learn that contrary to popular contemporary thought, eugenics was not only a state-sanctioned effort, but rather a mixed public-private affair. States passed eugenics sterilization laws, but many private actors, eugenics organizations, social reformers, professions, including medicine and academia, worked with states to make the eugenic agenda happen. And we learned here that we know very little about persons who are confined to state institutions for eugenic reasons. We know something more about people who were sterilized because there was a process that had to be followed and certificates that had to be filed, but not true around the institutionalization or the confinement of people for eugenic reasons. We learned that eugenics in the 20th century was not a pseudoscience, except maybe as we see it in the rearview mirror. At the time, most scientists believed eugenics to be solidly scientific. And despite the dominant narrative being largely a history of great men, many women participated in eugenics as philanthropists, social workers, nurses, physicians, educators, and reformers. And even if we narrow our eugenic lens to the publicly funded involuntary sterilizations, the story was not over in 1950. In some states, legal eugenic sterilizations continued, for example, in North Carolina, until 1973. Also in the 60s and 70s, thousands of Indigenous women were unknowingly sterilized in Indian Health Service facilities under a federal family planning program. In the early 2000s, about 150 incarcerated women in California were sterilized without their consent. And today, a majority of states allow certain persons with intellectual disabilities to be legally sterilized without their consent. Now, every one of the hundreds or thousands of hospitals where sterilizations were done or where people were confined has a eugenics story. So too, of course, does every sterilized or institutionalized person, and so too does every healthcare profession and professional involved. Right? And we need those stories to get an accurate history, to know who was harmed and how, to advocate for moral analysis and repair, and for the prevention, or at least the reduction of harms in the present and future. Now, this is not to say that we don't have some good histories. We have some excellent histories of eugenics programs. Here are some by state, some great books that are out. And we also have some by particular institutions, or in focusing on particular institutions, but very little in any of that focuses on medicine or healthcare and their role. So that's where we're going. So a close look at the roles that healthcare professionals, and in particular, I'm going to focus more on physicians, played, reveals, like I said before, that most physicians embraced eugenics, supported its ideology, and participated in its practices. The most obvious involvement of clinical medicine in healthcare was sterilization. Vasectomies for men, largely salpingectomies, removal of fallopian tubes for women. As noted, there were more than 60,000 of those surgeries, and that number is very likely a large undercount because those are only the known surgeries, the ones for which certificates were filed. Procedures were done in local general hospitals, sometimes in state hospitals and reform schools, and physicians were paid fee for service by the state. The surgeries were largely involuntary, and that is to say, largely without patient consent, with few exceptions. But physicians weren't simply surgical technicians in this. Physicians were also diagnosticians, right, who assessed potential surgical patients for feeble-mindedness or insanity or other conditions that might make them eligible for sterilization. I don't know how well we can see this, but this is actually a sterilization consent form from Vermont in the 1930s. If you can see at the top, but maybe not, overall, each procedure requires the signatures of 3 physicians. 2 physicians at the top, you can see, had to deem that a person was feeble-minded or insane. And that not only that they were, but it was likely that their children would be. So 2 physicians had to sign off on that. The legal process required their notarized signatures. And after the surgery was performed, the surgeon would sign the certificate at the bottom, which was then filed with the State Department of Public Health. Notice that Vermont required consent of the patient and or of the guardian. We could have a whole conversation about what that meant at the time. Some states had state eugenics boards that evaluated applications for sterilization, and they had at least 1, if not more, physicians usually on that board. Other ways that physicians were involved in eugenics. The superintendents of state hospitals, other institutions, were often physicians. As overseers of what were then called inmates of state hospitals for the mentally ill in particular, reform schools, schools for the feeble-minded, these physician superintendents were the final authorities regarding confinement. They made decisions about who was accepted into the institution, who was released, and what happened throughout the residency, including sterilization. In some states, sterilizations, as I mentioned, were legally performed only on institutionalized persons. But in some states, sterilization was a condition of release from the institution. Physicians, both as individuals and as representatives of medical societies, served as expert witnesses regarding legislative proposals about sterilization, about the creation of new state institutions, about marriage laws, and about immigration laws. Some physicians became active advocates, even leaders in this kind of promotion of eugenics. The first state sterilization law was in Indiana in 1907. It was enthusiastically promoted by a Dr. Harry Sharp, early adopter and promoter of the vasectomy. In Vermont, physician and governor John Mead proposed and strongly advocated for the nearly successful 1912 sterilization law. Individual physicians expressed their perspectives in local and state newspapers. Medical journals of medical societies published editorials, both state and national, and physicians were members and board members of eugenic organizations, again, both state and national. Physicians and often nurses functioned as public educators also. This is just one of many actually kind of hilarious slides about better baby contests, right? Which offered also mothers' workshops, often at county and state fairs, where they would assess the quality, if you will, of this human being, first known as scientific better baby competitions. What I'm going to say is a group of physicians were concerned about the kind of assessment that was done. And so they developed a better baby scorecard. Here is one, there were many, but this is one which adds up to 1,000 points that each baby was assessed on. And looking for the more superior babies, right, here. And the idea was to create more of these superior babies, right, and more of them, a kind of protonatalism, right, of a century ago. Here. Some physicians functioned as medical inspectors, right, for entering immigrants. In other words, as gatekeepers for those that were deemed unfit to keep them out of the country. Psychiatrists and psychologists played a central role in eugenics as they focused on mental health, primarily through measuring of intelligence testing. And here's one sort of typology that was formed by somebody in Virginia, and all of these are different levels of what was generically called feeble-mindedness back then. They functioned as test developers, as data collectors and analyzers, and they scientifically sorted the intellectually weak from the strong, producing test results that could justify sterilization and/or institutionalization. Now, in this early eugenics era, few physicians publicly resisted participating in these activities. And I haven't found any narratives of physicians functioning as what we might today call whistleblowers at that time. Although historian Rebecca Kluchin has described some such physicians actively calling out sterilization abuse in the 1970s, but not in this earlier era. So social work also had a special role in eugenics. It was a relatively new profession in the early 20th century, concerned mostly with child and family welfare, but they did it through really what were thought of then as scientific methods, new methods of casework and fieldwork. I'm going to tell you about Harriet Abbott, who was a Vassar College graduate and also very active school, then Chicago School of Civic and Philanthropy, which I think has morphed into the social work school here at the University of Chicago. After that training, she was hired as a caseworker in a new private organization, the Vermont Children's Aid Society. She spent the next 6+ years traveling all over Vermont, right, gathering data from families and anybody in town, essentially, who would talk to her about families, identifying children in need, constructing these family genealogy pedigree charts, looking for evidence of heredity of inferior traits. She worked with state welfare agencies and placed young and old into foster families, reform schools, and psychiatric hospitals. She then took a similar job, right, with a newly created, also privately funded state eugenics project in Vermont. She studied more advanced techniques at ERO in Cold Spring Harbor. And in the survey, this eugenics survey, which is the state organization in Vermont, in the first 4 years, she and other caseworkers compiled these genealogy charts on 62 Vermont families involving more than 6,000 Vermonters and going back 3 to 8 generations. This is how fine-tuned they would try to make their research. Although they receive relatively little recognition for their work, I think it can be reasonably argued that social workers, along with physicians, were the workhorses of US eugenics. So it's clear, right, that many healthcare professionals were involved in eugenics. And so I think what we need to do is remember and deal with the harms that were done through that period by healthcare professionals. And I'm just going to list, I think a starting point is to just name and list some of those. The violence and dehumanization of involuntary sterilization, right? The loss of procreative capacity in certain types of family formation. The violence, I would say, and dehumanization of forced institutionalization. Imagine the family breakup, the separation of often young persons from family, sometimes lifelong, and subsequent intergenerational trauma in those families and communities. The lack of respect for persons, including their autonomy and their bodily integrity, operationalized, no pun intended, as lack of consent. The exploitation of labor, right, of institutionalized persons. For many were made to work in those institutions as farm labor, caregivers for infants or other inmates, as in-house laundry workers and domestic labor in local homes. Think of the marginalization and the stigma of being labeled one of these inferior persons. Intergenerational and community distrust of medicine, a harm done. And throughout all of the above, the oppression and injustice of being disproportionately targeted as members of certain communities. Other harms, the reinforcement of scientific racism that assumes, for example, that Black bodies are genetically distinct from white bodies, and the reinforcement of an ableist model of disability that assumes that some lives are more worth living than others. Now, this is the important point. Remarkably, medicine and healthcare and its harms have been largely, but not entirely, they've escaped ethical attention. What might moral repair or justice look like in response to healthcare's eugenic harms? And how might healthcare advocate to repair its advocacy of eugenics? So I just want to say a little bit about some of the moral responses, for the most part not found in healthcare, but outside of healthcare. And I think something healthcare can look at. A few state governments have publicly acknowledged their participation in eugenics. Some have taken further steps to attempt to redress and mitigate harms through apologies, memorialization, renamings, financial repair, right, and reconciliation. So let me say a little bit about apologies, state apologies. These are the 6 states that so far have issued apologies, either their governor or the legislature, for their state's part in eugenics. Okay, that's 6 of the 33 states that had eugenic sterilization laws at the time, so about 18%. Some unknown number of colleges and universities also have apologized for their activities, including eugenics courses, supporting eugenics research, and faculty advocacy of eugenics. Now, just a comment on this. Rarely do institutions initiate apologies on their own, right? Rather, they're often a response to community pressure, and often by the communities that are most affected. I think one of the positive effects of even considering an apology is that it requires historical research, and that research at its moral best includes meaningful engagement of affected communities. Appropriately, every apology is unique to its particular context. So you might just think about the institutions you've been involved with in healthcare, and what do you know, A, of their eugenics history, but have there been any attempts to do any of these kinds of repairs? Again, every institution is different. It might include a commitment to future action, but not always. Some apologies require no significant material or structural change in the institution, right? And as such, that apology may be simply performative and have little reparative value. In the wake of George Floyd's murder, a number of professional groups, medical professional groups, and I'm just going to mention two here, undertook an examination of their profession's part in racism, not specifically eugenics, but inclusive of it. So here are just a couple of these reports, quite different in many ways, but the American Psychological Association issued this in 2021, and the American Society of Human Genetics in 2023. Both reports apologize broadly for their racist histories. They go into different depths about what that was and what that looked like. In both cases, eugenics was cited as part of those histories. And both center scientific racism, particularly anti-Black racism, and both commit to additional repair in the future. So apologies, memorialization. A number of states have placed plaques like this, historical markers, right, to do a little bit of education and recognition of what happened in their state. Here's a memorial of a very different kind. From 1968 to 74, more than 200 low-income Spanish-speaking Latinas were sterilized without their consent at the LA County USC Medical Center. 50 years later, the medical center installed a permanent art piece in the hospital courtyard. It's called Sobrevivir, to survive. And some words of the sterilized women that are part of this piece, they're kind of around the inside of that circle, say, if you speak English, they treat you one way. If you don't speak English, if you don't speak English, they treat you another way. Renamings. Renaming the building or outdoor spaces or awards or fellowships often follows an apology, right, or maybe coupled with it, but seeks to eliminate the name of someone who was involved in eugenics. So remember that physician governor I talked about, Mead in Vermont. He was also a Middlebury College graduate and also was on the board of trustees later, and he donated funds to build a college chapel in his name. Mead Chapel was known as such for over 100 years. But in 2021, after a college working group had researched Mead's eugenics activities and his influence in the state, the college removed the name Mead and now call this building simply Middlebury Chapel. Middlebury Chapel. So this is an interesting, I think, strategy because nationally conversations continue about whether this is a strong or weak kind of reparative strategy. Some worry that the removal of the name erases a history that should be remembered. Others worry that keeping a name perpetuates the institutional honoring of eugenics and continues to traumatize some of the most affected people and their families. Financial reparations. 3 of the 33 states that had sterilization laws back then have offered financial reparations to survivors of state-sanctioned sterilization. I'm not going to say too much about this because, again, this is huge. California just is almost done with their program, not quite, but there's a lot to be said here. But I want to move on to something that's kind of unique and different. Also in Vermont, as it turns out. In 2021, when the Vermont General Assembly unanimously apologized for state-sanctioned eugenics, it committed to doing more. The House committee chair, who spearheaded the apology, initiated a process for its committee to learn about Truth and Reconciliation Commissions. With a New York-based, it's called ICTJ, International Center for Transitional Justice, they studied TRC processes in Maine and Canada and beyond, and then they passed a bill authorizing and funding a Truth and Reconciliation Commission with a 3-pronged charge to examine and begin the process of dismantling institutional, structural, systemic discrimination in Vermont, both past and present. Not at all ambitious, right? Secondly, to establish a public record of that. And third, to identify potential actions for repair and maybe prevention in the future. Now, what's interesting is there's no specific mention of eugenics, right? Either in this charge, actually in the entire law, though the legislation was clearly motivated by the eugenics apology and the political momentum that it built. So the work of the commission is now well underway, with current attention focused on creating safe spaces for truth-telling by marginalized communities about their experiences of discrimination, including eugenics. So all of these strategies, apologies, memorialization, renaming, financial repair, and TRCs, are mechanisms that states have used, something we might think about also in healthcare. So let's move on to transitional justice. Interestingly, those same mechanisms that I just mentioned are also elements of a framework called transitional justice, typically used by governments in countries that have experienced massive human rights violations. So you've probably heard of TRCs in South Africa or in Rwanda and other places. TJ, as it's called, processes help states and institutions transition often to something like democracy through the creation of context-specific processes for healing. So I bring this to healthcare in part because several months ago, the New England Journal of Medicine published this piece called Transitional Justice, a politico-legal approach to health equity. Dr. Emily McNeil and her co-authors advocate for a transitional justice framework in the US because, in their words, US medicine, after all, evolved within a deeply unjust society in which slavery, experimentation, etc., were widespread ideologies and practices. Moreover, many injustices persist. I'm just going to continue on. US healthcare could be characterized as a site of ongoing human rights abuses, warranting greater institutional introspection, restoration, and reconciliation. Interestingly, then the authors go on to speak about 4 pillars of transitional justice, and they're much like the states have been working on, right? Truth-telling often being the first one and the biggest one, just certainly a place to start. Memory and memorialization, accountability, which they understand often as apologies and reparations. And what's interesting about this is that they find at least glimpses of each of these, right, in current day healthcare. So as to say, this isn't just pie in the sky vision, but something we could actually do. So it's intriguing, I think, that this model of transitional justice engages many of the same forms that states have, but it actually makes some sense when you remember that US eugenics and US healthcare, right, were steeped in and both reflected and reinforced sort of racist, misogynist, classist, and xenophobic contexts of the US. And therefore, I think transitional justice might offer us a fitting framework for thinking about US eugenics. So to wrap up, let me go back to the beginning. The dominant narrative of US eugenics neglects morally relevant in social context and relations and says little about healthcare's role in eugenics. Fuller narratives reveal the oppressive social context within which eugenics grew, the breadth of public and private entities involved, and the disproportionate harms experienced by some communities. Physicians and other healthcare professionals participated in multiple ways, creating multiple harms. A few states have attempted reckonings of various sources, and transitional justice in healthcare is this emerging framework that advocates these strategies, potentially ending the silence around US eugenics. And finally, I close with this piece of art called the Witness Tree, a recreation of the iconic eugenics tree that you saw earlier, created by Judy Dow. It reads, "Anti-eugenics is the collective creation of an equitable and healthy world for all." So with that, I thank you for your attention and look forward to any questions or conversation that you might have.